Hello all, this is Dr. Timani, and this is Skin Awareness Month, and there's nothing more powerful than talking about a skin cancer on a patient who has a skin cancer diagnosis. Melissa here, who's an awesome and sweet patient, will let us show her skin cancer. She was noted to have a little non-specific pink lesion on her back that was noted at body check. She can't see it, of course. And this can easily pass as a non-specific patch or a dry patch or a strawberry patch, but when we did the biopsy, it came back as a basal cell carcinoma. Basal cell carcinomas tend to be the most common type of skin cancer. They are better behaving than other cancers, and if treated, the chances of them metastasizing is smaller than squamous, definitely much less serious than a melanoma. But what I wanted to say is, look, I mean, she got a cancer on the lower back. It's probably an area where she missed a sunscreen when she was younger. Yesterday, we operated on a lady that had a squamous cell carcinoma on the top of her foot, and she recalls putting sunscreen on her skin. You guys can keep yourself safe by applying sunscreen. Melissa, you want to chime in? Say something, save a few lives?
I just want to say that Dr. Timani's amazing, and she's done a great job on me, and definitely get a yearly. If you've never had one, go. I didn't think I had any cancer, and I've had 5.
Oh,
So do it for sure.
oh, bless you, Melissa. Thank you all. Hello all, this is Dr. Timani, and it is Skin Awareness Month. My patient here is being treated for a basal cell carcinoma, and we're doing what we refer to as the elliptical excision right here. We take margins at least 4 to 5 millimeters on each side, and we go down to the fat, and it looks like an eye, right? When we bring it together, the patient will have a line that is much longer than the original. And it's amazing seeing how small the cancer started and what a much bigger scar the patient will develop. But I wanted to say many other things too, and that would be that besides the cosmetic aspect of a final wound, the patient goes through a lot of stress. When we see a spot that we're concerned about, they have to wait for the biopsy result to come out. There's a lot of anxiety there. And then once we have the diagnosis, they have to get recommendations for the appropriate surgery. And then we have to send the specimen out, and we have to wait for clearing from the lab. And then they live most of their life fearful of another skin cancer. So it's not a fun thing to get a skin cancer. Please make sure you get your body checks every year. And for those of you that have had a skin cancer, make sure you get a body check every 6 months for at least 5 years. Most of the spots that are concerning are on areas that you can't see and you can't watch and you can't examine yourself. So can you go back in time and tell me, when was your first cancer diagnosed?
Okay, I want to say my first one on my arm was maybe 5 years ago, and it just popped up. It was like a little fleshy mole, but it kept getting bigger. I didn't think a thing about it, but because it got bigger, I came to you, and you immediately looked at it and said, yeah. And because I had let it go, it was pretty big.
Yeah.
It was on my arm, I'll show you. And then I've had one on my shoulder, my neck, and this one. And then I've had, well, probably 2 actually that you treated with chemo, because one was on my face. And then I guess maybe another one on my shoulder. No, on my chest.
And you know, Melissa, you are on video, but do you know that right now you have to come back every 6 months for body checks for like at least 5 years, because every time you get a cancer, your risk stays higher for another 5 years. But yeah, we've kept you safe, and we will. Do you do body checks yourself? Do you do self-checks as well?
I do.
Tell me about those. What's your system?
I just try to be very aware of anything that I notice when I put lotion on. So I look at every place where I can see. And I do think it's important is I check my head, and I have my hairdresser when she does my hair. I'm like, check my head and make sure you don't see anything, feel anything.
Absolutely. I had my hairdresser many years ago discover a dark spot, and I got it removed. Absolutely. And then nail polish needs to be taken off, you know, fingernails and toenails as well. But this is what we call the elliptical excision right here. What you're seeing are the fatty layers of the skin. You notice a little nick here towards 𝗡𝗘𝗩𝗘𝗥. This is an orientation nick for the lab. in case there's leftover. They'll tell us where the leftover could be. And in a second here, we'll be getting the edges ready for the closure. And that's it. It's very uncomplicated and going very well. And here we are, just kind of like closing up. Everything's going very well. Are you okay, Melissa? Are you feeling anything other than tension and pulling on the wound?
Nope, I'm doing
No.
good.
Tell me about your daughter. You reminded me of her. What's her story?
My daughter is 27, and I have never, thankfully, had a melanoma. But my daughter had a little place on her leg that was itchy. She asked me about it. And I said, you need to go to the dermatologist right away.
Mm-hmm.
And I really didn't think anything about it, but I just knew she needed to have a check. And she had melanoma.
Unbelievable.
27. So it is so important, anything that comes up, to have it checked.
What did it look like? Do you remember?
Yeah, it was totally flat and
Uh-huh.
kind of brown,
Uh-huh.
but it was not like a circle,
Yeah.
like a bowl. It kind of had, but the thing that really threw me off was
Uh-huh.
it was itchy.
Oh.
And so I thought, that's not normal.
Mm-hmm.
And so I did tell her to get it checked, and thank goodness she did.
Do you have any family history of melanoma?
No.
Any family history of pancreatic cancers at all?
No.
No. And you know what? Good point. What I wanted to say is not all melanomas are your typical. It's a little bit long, so you want to bury it. But not all melanomas are your typical raised bump. Some of them can be flat. Some of them can be very, very subtle and look like a sun patch or a freckle. But I would say the take home, and some of them can be pink. It's unbelievable, especially in people that are very, very fair skinned. But I would say the take home message surely is, if you notice anything new that is changing. I mean, we talk about ABCDs: A for asymmetry, B for border, C for color and diameter. And people always have unique moles and may have one or other feature. But I would say, if I had to add a letter, it would be another C for change. All right. And that includes definitely, new spots. So now, how's she being monitored?
She has done really well. She did have to have a pretty invasive surgery. They
Oh,
had
yeah.
to take some of her
Yeah.
muscle out.
Oh, yeah.
And she has done really well, and she is going every 6 months. And I will say, she does live in Florida, so she is in the sun a lot more. But I have religiously tried to put sunscreen on her, but it was a weird place inside her leg on the bottom. And so that's a
Unbelievable.
place you put sunscreen on the front and the back, not down the middle.
Totally. And I would be very wary about like brown spots on the bottom of the feet, like you said, in the scalp. I always recommend eye checks for my patients as well, and you need them every 2 years, because there have been reports of melanomas in the eyes in general. And I would say physicals all the time. The reason I like physicals and question physicals is because you need other cancer screenings performed as well. Recently, there's been a little link with familial melanoma and pancreatic cancer, so I always ask about that. But Melissa, seems like you're doing an amazing job. Thank you for sharing the story of your daughter. I hope she stays safe. And she does body checks every 6 months, right?
She does. She went every 3 months.
Every 3
for
months.
the first year.
Absolutely.
Yeah.
And then every 6. Yeah. And her diagnosis was what, like 5 years ago, you said?
No, like 2.
Like
and a
2?
half. Yeah, yeah.
Wow. Unbelievable. All right, I hope she stays safe. What Melissa has mentioned is so important, and Melissa is on video to try to save a few lives. All right, so here we are at the very end of the elliptical excision, and we just completed our running sutures. It's a perfect line. Everything came together very nice, and she has 2 layers of sutures. The deep ones her body will take care of. The top ones will cut in 2 weeks, and she's feeling great. All right, we did it.